Good afternoon. I want to welcome everyone to the Appropriations Committee. This afternoon we have a full briefing, two briefings actually scheduled today that we're going to be hearing from. One, the Department of Legislative Services on executive agency staffing concerns. And then second, we're very pleased to have with us today from the Senate, Senator Katie Fry-Hester, who will, along with our own Delegate Pat Young, these were two co-chairs of the Joint Committee on Cybersecurity, Information Technology, and Biotechnology. This is an issue that we will be dealing with throughout this legislative session. There will be legislation, and I'm very pleased to have this presentation this afternoon. It's very timely. They will also have a panel, which I will allow them to introduce as needed. So with that, let us delve into the first issue, and we're welcoming Secretary Brinkley. Welcome to the Appropriations Committee, and also Jason Kramer, who's the Principal Policy Analyst. Jason, you want to go first?
I'd love to. Thank you, Madam Chair. Again, my name is Jason Kramer. I'm a personnel analyst for the Department of Legislative Services, and I was asked to tell you a little bit about some staffing concerns in the executive branch of state government. So I'm going to go through that right now. And I think Dana is going to share the screen. Yep, there we go. And we can just go right on to the first slide. I'm going to talk about just vacancies in general. And also talk about specific types of vacancies in state government, the impacts that it's having on the state workforce and state agency performance. And then I'll broaden out and talk about the labor market in general, and maybe talk about a few ideas and strategies for dealing with this issue. So we can move on to the next slide. The first slide is a look back at quarterly vacancies in the executive branch, higher education, and in judicial and legislative branches over the last 13 years or so, which is as far back as our records go. As you can see on the far right, that top red dot, there are more than 6,000 vacancies in the executive branch, excluding higher education. That's more than there have ever been in our records. In addition to those 6,000 executive branch vacancies, there's another 2,200 or so vacancies in higher education. And if we can go to the next slide, we can look at that by department. This is a familiar chart that you see quite often. You'll see it next week in the fiscal briefing. In the past, we would point out some outlier departments like public safety or maybe the health department, but as you can see, there really aren't any outliers. Vacancy rates are high across state government, with maybe the exception of DHCD, Housing and Community Development, which has the lowest rate among large departments at only 6%. We move on to the next slide. A lot of time we talk about vacancies and authorized positions, and what we don't talk about is actual filled positions. And that avoids talking about vacancy rates and vacant positions. This shows the number of positions lost each year since January of 2018 among the state personnel system and MDOT. So that excludes judiciary and the legislature, as well as higher education and non-budgeted agencies. So you can see that since January of 2018, the state has lost more than 2,000 filled positions across the large portion of the executive branch. It's an average loss of about 1.2% per year. It's gone from 44,480 in 2018 down to 42,400 filled positions this month. And as you can see, that more than 1,000 positions have gone unfilled, or the number of filled positions has been reduced by over 1,000 just in the past year. That's a 2.4% reduction. And then on the next slide, we can look at that by sort of narrower job categories. There are about 800 or so classes of state workers in the state employee management system. This breaks it down into about 8 different larger broad categories of jobs. As you can see, there has been a lot of concern in the past about protective service workers in the middle there, and you can see that that category of workers has actually been fairly stable over the last 5 years. However, among professionals, paraprofessionals, and office and clerical employees, there's been significant drops in those categories of workers. And then we can look at the next slide, and that this shows similar data just by vacancy rates. These job families, by the way, are federally defined EEOC categories. And as you can see, with that focus on protective service workers, that vacancy rate has improved, although that's due in part to abolition of vacant positions, while the vacancy rate for professionals and paraprofessionals and office and clerical workers has increased significantly over the last 5 years. We can then go on to the next slide and talk about what some of the impacts of this loss in state workers has caused. One thing we thought we'd look at would be overtime spending in state government, state personnel management system agencies. There hasn't been a significant impact here. However, a caveat would be that agencies don't necessarily always categorize their spending by sub-object exactly correct, so that could be part of it. But the impacts don't seem to be showing up in overtime as yet. On the next slide, some other impacts that this could have would be increased caseloads per worker, lost experience, the added cost of hiring and training due to churn of employees. There's lots of examples, but they're all very specific to specific agencies. And so that'll all be discussed in individual budget hearings as we go through the session. Pulling back even further on the next slide, we thought we'd take a look at some vacancy rates from other states in the country. This is some data that we were able to find from other states. And as you can see, that 10 to 15% vacancy rate that Maryland is experiencing is not really out of line with what is seen across the country. The one thing I would say here is this data may not be comparing apples to apples. We don't really know exactly the levels of personnel control other states have, but it gives a good picture of this being a significant issue across the country. On the next page, we'll pull out the picture. Oh, I think we skipped something here. Or maybe yeah. Can we go back a slide? Yeah, there we go. This is national job openings from the US Bureau of Labor Statistics. And this is the labor market as a whole, not just public sector workers. As you can see, that big black spike in the middle, that was the 16+ million job losses during the first few months of the pandemic. And then you can see that the yellow line, there was some recovery immediately with new hires immediately after, but not as rapidly as the black line grew at the early part of the pandemic. But what I think this chart really shows is that red line on the right, the number of job openings that has increased significantly over the last year or so. That shows there's more than 10 million job openings currently. So lots of choices for people looking for work and lots of employers competing for employees. And then we can go on to some recent news articles that have been around that you may have read. According to Pew Research, many states like Maryland are offering raises and bonuses to their employees. In a survey reported by Pew, about 1/3 of state workers said they considered taking other jobs, with half of those saying the reason they were looking for other jobs is due to pay. And many state leaders reporting difficulty competing with city and private sector job offers. On the next slide, Just last week, your colleagues in budget and tax were told by a Moody's analyst that it's going to be incredibly difficult for state government to attract and retain talent, and that the state and local quit rate is as high as it has ever been. And on the next slide, in Route 50, which reports on public sector, public government, they reported on a survey, and the survey showed the top two ways employers could retain workers was with compensation and flexible schedules. And that provides me a good transition to the next slide, which shows what Maryland is doing what the governor is doing in the state budget this year. These are all the various salary actions that have funding included in the budget that was just introduced. AFSCME members receiving a $1,000 bonus and a 2% and then a 3% COLA plus increments in January and then again in July. Similarly, AFT, MPEC, and non-represented employees are getting a $1,500 bonus plus a 1% COLA and increment this month, and then a 3% COLA and increment in July. And then Saliola getting a 7% COLA and increment in July. On the next slide, this just shows the cost in the current budget, a little over $240 million in fiscal 22, and then just under $600 million in 23. That totals $832 million in spending on employee compensation increases in this budget. And then finally, on the last slide, like was noted, it's not just compensation. There are other policies the state can take to retain and recruit workers. The state has expanded its telework policy. It's introduced a new program called MD Cares, which is a mental health outreach program for state employees. Smart Work, which is a student loan reimbursement program, additional COVID leave, and removing some administrative burdens on agency hiring. With that, I'd be happy to take any questions.
Delegate Resnick.
Thank you, Madam Chair. I have two questions. Thank you, Jason. That was really helpful. Two quick questions. Can you, in terms of the vacancy rates that you've seen over the last few years, have you seen the dramatic rates with Sliola members versus other bargaining units or other departments?
That's not data I've looked at by bargaining unit, but that's something I can look at.
But in terms of, like, we know where Sliola is, right? The FA, the Highway Patrol and others within the public service sector, public safety sector. Have we seen that kind of dramatic, those kind of dramatic vacancies with regard to Highway Patrol and other Sliola members versus other departments?
I'm not sure if I have that in front of me now, but I can definitely get that data for you.
Because the information you were showing about this year's compensation, I'd like to highlight, and I get your confirmation on it. Sliola has had several years over the last few years of increases and other compensation benefits versus the other departments. This year, I'd love to see glad to see what's in the budget, but this is the first time in a number of years that AFSCME has gotten a real salary increase. So would there be a correlation there between actual compensation being provided in previous years to result in this year's vacancies?
I wouldn't be able to
Okay.
Do that without knowing what the vacancy rates by bargaining unit are.
Okay, sounds good. Second question I have, you talk about the loss of positions. Have we seen, do you have any data about the departments swapping those positions for contract employees, taking those people out of the merit system and putting them on a contract basis? Have we seen what that correlation has looked like?
I have not looked at the changes in contractual employees, but I can look at that and see if there has been significant changes over the last several years. I would say that I think most as we go through the budget every year, we do highlight changes in contractual employees. And that's something that we would point out as we come across it.
That would be helpful to see. Thank you so much. Appreciate it.
Okay, I'm gonna call on Delegate Barnes, who is Bridges, who is a year older today, I think. Is that right? Is that true?
That is correct. Today is my birthday. So
You aged
you.
a year overnight.
The gray hairs on my head definitely show it.
Yeah, thank you. Go ahead.
Yep, thanks. And thanks for the presentation, Jason. Just a quick question in terms of the public safety agencies, which seem to be the highest vacancy rates that we have versus the other agencies. Have we looked at, I know you talked about the raises or bonuses for current employees. Are we also looking at, or has the state looked at possibly just raising the compensation levels at those agencies as well? And I guess the second question to that is, what is the market for those vacancies versus other states? I don't know if you have the information to share something like that with me.
So I do not have comparisons for types of employee vacancies in other states. That's something we can look into. I do know that our wonderful librarians did a lot of research for me, and they've found that other states are not as good at collecting data as we are. So it proved to be a little difficult. And as far as your first question, I know that when you see the chart about increments and COLAs, I think that those for current employees, it doesn't matter a lot whether it's a COLA or an increment. But for future employees, people who are not yet working for someplace, but who will be in the future, a COLA is a better, because that has the effect of shifting the entire salary scale up a few notches. So I guess that's what I would say about salary increases in that way.
Yeah, I guess my question was more along the lines of starting at a higher salary to attract folks rather than looking at what those increases are over the years.
Right. I think I can get some information from DBM on that.
Okay, Delegate Valentino Smith.
Thank you, Madam Chair. And the good Delegate Bridges not only looks a year older, a year wiser. Jason, I'm sorry, sometimes I suffer from remembering what we do in the House and then are not quite sure whether the Senate did it or not. But I know that Chair Resnick and I have been struggling for a long time with the workforce shortage areas in the health and the human services side because of the direct impact to care to some really challenging individuals. And we had heard that they were putting in tuition reimbursement, and there were some tuition forgiveness programs. And have we seen any, did they actually get implemented, and how are they working, and what's going on with whether or not in the workforce shortage areas we can use tuition and getting people educated in something and agreeing to work for the state, and or forgiving their tuition if they're working in a workforce shortage area for a certain number of years?
Unfortunately, I don't have that in front of me. I do believe there is funds in the budget this year. It's just not in the personnel area. I believe it's in the agency budgets. But I can get that information for you shortly.
Okay, thank you. Just again, wondering whether or not through tuition and we can encourage people to get the expertise in these areas and then agree to work for the state. Thank you, Madam Chair.
Mm-hmm. I'm going to ask Secretary if you can comment on a couple of these questions. One, I know you have within the budget, Mr. Secretary, some funds to fill vacant positions. You've taken a real run at trying to increase salaries, bonuses, so on and so forth. If you would like, just talk about that for a second. But so is there built into agencies that you know of the tuition reimbursement piece? Do we have, or do you have a handle on the number of contractual employees that have been generated over the last few years? and possibly even address Delegate Resnick's questions if you have it.
Can you hear us okay? I don't know.
Yeah, we can. Thank you very much.
On one of them, because I saw Cindy making some notes. Why don't you address the issue about tuition reimbursement and all that? Some of that was negotiated, wasn't it?
Yes, so the tuition reimbursement, we do have that in place. Cindy Colner, Executive Director of the Office of Personnel Services and Benefits. We did implement the tuition reimbursement Smart Work program. It's in the budget for the various agencies. Unfortunately, we didn't have a lot of interest in the program. But what we did do recently with the nurses union was we implemented a 36-hour work schedule, which is what the nurses union wanted, as well as MDH. They thought that that would help us attract nurses from private industry, that they could work 36 hours. And then if they wanted, they could just have the rest of the week off or work someplace else. But we are hoping that the 36-hour work week will be a big draw for our nurses. As an aside, we lowered the work week to 36 hours, but we did not decrease the pay. So they are getting an equivalent 40 hours of pay for 36 hours of work. So that was a default pay increase for the nurses.
And I think also, as I recall, that's also an industry trend, which is
Yes.
one reason why they were asking for it. We proposed that in previous years, but got a lot of resistance. And,
Right.
Now we're able to successfully move that forward. So then on the contractual employees, I think in turn, and by the way, I had my notes set up for when I make my presentation, but I'm David Brinkley, the Secretary of the Department of Budget and Management. Cindy Colner, you see on the screen with me, but off in the wings, I have my Deputy Secretary, Mark Nicole, and we have Laura Vicol on the other side. And I got the preeminent John West handling the technology. So if you see something fail, he's the one that gets the blame on it. So he's up front and they're all off camera. But the other question that we had, I think on the contractual side, we're sitting here saying, as we heard the question, that's a good question. We'll have to take a look at it. I do know that the request that we've had recently on the contractual side was not from the perspective of replacing any type of employees, but it was to be able to get people in quickly to react to the needs, particularly at MDH, on the pandemic, just to get some people in, get some people out based on those types. For instance, doing some of the testing sites. I think we had some contractual setups to get people to come in just to handle traffic. I could be speaking out of turn here. But I know we even reassigned some people. We had some people at DBM that went down to the Prince George's site just to handle traffic control, just as a part of responding to that. And then the third question, help us out as to.
It was Delegate Resnick asked about the vacancy rates, and for instance, in the state police and highway, where they've been getting very, I think, generous increases on an annual basis compared to other.
Okay, I recall that.
Workers. Yeah.
And yes, they have been getting generous increases in that regard, but keep in mind that law enforcement is one of the challenging forces that we have to recruit to. And we still have substantial vacancies there. It's not just unique to MSP or any of our state operations with the toll facilities or with DNR. We still haven't been able to fully fill those classes and move forward on that. We changed some of the hiring requirements in all police agencies, Baltimore City. I know my Frederick County Sheriff, they're all having challenges filling law enforcement roles. So that's not unique, something I think to our state. Mark, anything I've left out, or Cindy, anything I should? Okay.
All right, we do have a couple more questions. You can.
And then I have a presentation too,
Okay.
to go through, nothing for the screen, but I don't know if I'll answer any of the questions with what I have to say.
Yeah, why don't we take these a couple of questions and then we'll move to your presentation, okay? Delegate Smith.
Thank you, Madam Chair. Thank you, Secretary Brinkley, and also thank you to DLS staff for the presentation. Perhaps you'll be covering this in yours, but I hear a mixture of some programmatic efforts to retain as part of the recruitment strategy, but I wanted to know if part of your recruitment strategy was any type of kind of like really memorializing relationships between our state colleges and, you know, from a fellowship to interns to help kind of be some of those entry level, you know, roles that you need filled. I just don't know if you have a recruitment plan that's very concrete in building those pipelines with our state universities.
That's a good question.
That directed to us, I presume.
Yes.
Yes, sir.
Let's go ahead.
So we handle exclusively the recruitment and for the state personnel management system, which are the agency, the executive agencies and the executive branch. We are not involved in any way in the hiring for the colleges and universities, so we don't have that answer.
Oh, I apologize, not for hiring at the universities, but using the universities as a pipeline for filling those vacancies you're mentioning.
Mark, yeah, come on up.
So good afternoon, delegate, members of the committee. Mark Nicole, Deputy Secretary. So we did enter into a partnership with the University of Baltimore, the Schaefer Center. So we've put some additional funds into their budget for fiscal year 23. They have a lot of sort of fellows and scholar sorts of programs. So we've added an extra $400,000 to sort of beef that up. Some of it is sort of a retraining for existing employees, but part of it is to sort of help students to foster interest in public service. So there is a little bit of additional funding in that area.
I do know, I'm just going off memory here, that certain agencies were very aggressive in where they were recruiting toward. I remember chastising corrections for not seeing their name up on a billboard when I was at Warwick Community College. And yet Baltimore City, Howard County were up on their board. And so I know that each agency has developed some type of strategies along those lines of trying to target certain universities that might have certain programs, if they were law enforcement or if they were health related,
Right.
or things along those lines.
Good. Okay. Delegate Solomon.
Thank you, Madam Chair. I actually had a question for Jason, although I will say Delegate Smith read my mind. I was thinking the same thing and would love to see the state agencies expand that way more, take advantage of the really brilliant students that we have in our university system. But Jason, I guess one of my questions was, and I don't know if this falls necessarily within your report or sort of maybe something that DLS could put together writ large from a lot of the other analysts who are looking at this within individual agencies. You know, I think we hear a lot of anecdotal pieces, like obviously we know the corrections piece, and there's been a lot of reporting on, you know, the lack of environmental protection and the, you know, the lack of evaluations and inspections. But, you know, in a lot of work that I've done with MSD in the childcare community, you know, the childcare payments for the scholarship program are, you know, atrociously delayed, and there's a lot of problems with getting grants out. But do you have any data, or DLS as a whole, maybe overlaid on where the vacancies are particularly high, on what that actually has meant in delay of services and impacts, so that maybe we could, in our individual subcommittees, more appropriately target, like if, you know, the childcare support payments are not getting out, we need to make sure that there's a hiring, you know, an expedition placed on the hiring there, or, you know, in other agencies. Any data like that exist, or something maybe you all could put together for us?
So yeah, I mean, that was one of the struggles I had working on this, was that I think a lot of the impacts of these vacancies are very specific to agencies. And I don't think there's a good answer. There's not one good answer to that question. I think I know all of our analysts are focusing on this issue for their specific agencies. So you'll be hearing that going forward through the rest of the session. What types of specific issues are being caused by worker shortages, if there are any.
Great, thank you.
Jason, as the chair, very specifically, I am interested in the health department, and even more specifically, the behavioral health division of that department. I mean, my committee members think I'm going to sound like now a broken record, and I will. They returned unspent this last fiscal year a very, very large sum of money, millions. And this in the midst of the height of an opioid crisis and in the height of a mental health crisis in our country and in our state. And I just can't justify that. I'm having a very difficult time justifying it. So that is one unit that I would like for you, just for me, for my purposes, to share with the committee, to take a look at that and ask the question, how, why? Was it vacancies that forced this agency to, in my estimation, not meet its constitutional duty? That's it.
I will pass that message along.
Thank you very much. Mr. Secretary, good to have you.
Good afternoon, Madam Chair and members of the committee. It's good to be here. This is our first, I guess, hearing since you've initially started, other than the briefings that we've had a couple times. And as I introduce the people that we already have here, I'll skip that part of my agenda here, but I do want to thank Jason for his work. You know, we enjoy seeing, I can't say we enjoy, but we like getting the perspective from other sides to see, you know, some of the questions that we can raise too. And then if we have some spots of disagreement, that's great. And then to Delegate Bridges, happy birthday. I hope you are another year wiser, but we'll see. From my experience in the House, every year that went by seemed to rack up another 10,000 miles in mileage on the odometer. And I don't know if that was necessarily appropriate, but so the Department of Budget and Management appreciates the opportunity to respond to DLS's analysis of agency staffing. So while we can and we do differ on exactly how many positions the state needs, we can all agree on one thing, and that's that more positions, quote unquote, in today's climate does not necessarily guarantee more employees and the people to do the work that's needed. Remember that vacant positions do not get the job done. Therefore, adding positions without qualified candidates willing and able to fill those positions doesn't accomplish anything. And this is where we do have common ground. The perfect storm of COVID hesitancy, the baby boomer retirements, and the great resignation has left all employers, including the state, and you saw on his accompanying slide in other states, a shortage of qualified applicants. Consider the fact that if agencies cannot fill the positions they already have vacant, there's no point in increasing the number of positions and encumbering those funds that will never be used as intended. The state's current vacancy rates are a reflection of the national hiring crisis and not an accurate reflection of the state's efforts to recruit and retain employees. Over the past 2 years, we have aggressively pursued compensation increases, work and life balance enhancements, administrative streamlining, and rebranding to retain employees and recruit additional ones. In fact, Madam Chair, I submit that this is our challenge, to create an environment where those leaving other positions, those that are resigning from other employers, consider the state for their next career move. And this is an opportunity within the challenge that we're all facing. Until existing vacancies are filled, creating new ones is an exercise in futility. So over the next 18 months, over 43,000 employees will receive wage increases of at least 12%. More than 2,200 employees in the most difficult to retain positions will receive an additional wage increase of 6%. These historic increases are the result of successful negotiations. I'll emphasize successful negotiations with all 6 of the state's exclusive bargaining representatives. That's the first time that's happened. And they come with a price tag of $850 million starting out. Recognizing the importance of health insurance to employees and applicants alike, we have continued to hold the employee share of health insurance premiums at a lower rate than which has been agreed upon with the state employee unions. In anticipation of the positive hiring effect of these actions, you will see in the submitted budget that the governor has reduced budgeted turnover across state agencies. Doing so permits the agencies to fill positions that would normally be held vacant due to budget constraints. The FY23 budget provides $68 million, which will allow agencies to fill nearly 800 vacant positions with their existing resources. This additional funding will also help agencies be more flexible when needed to ensure salaries remain competitive within this current hiring environment. While pay is certainly important to everyone, and there has been much talk of how low state employees' salary are, I want to take a moment to level this discussion. The average salary for state employees was $62,000 at the end of FY21. The salary proposals included in the budget before you, Madam Chair, will increase the average by more than $5,000 a year to $67,000. And as an aside, during the Hogan administration, average salaries of state employees increased by 35%, compared to a 13% inflation rate during the same window.
2022 is the right number. 13 is the net increase.
13 is the net increase. 22 is the right. Okay, 13 is the right. Let's say that again. 22 is the inflation rate,
Correct.
and 13 is the delta, the difference between them. Okay, sorry about that. In addition, and this is very important, that we also found in our surveys, for each employee, the state pays approximately $29,000 in fringe benefits, including health benefit premiums and the employer contributions for Social Security, the defined benefit pensions plan, which is not out in very many employers anymore, workers' compensation, and unemployment insurance. Therefore, the total compensation package for the average state employee will be, presuming, and I don't expect that you make changes to this to reduce it, would be in excess of $96,000 when the budget in front of you is passed. But then there's more. I sound like a pillow salesman there or something like that. There's more. The figure does not include the indirect benefits of the state's extremely robust leave package, which provides employees upwards of 64 paid leave days each year, plus the opportunity to receive additional leave in the form of COVID leave, parental leave, the leave bank, and employee-to-employee leave bank, and several other forms of incremental leave. Yet while we have budgeted for substantial wage increases in the FY23 budget, we do know that our workforce still has significant pay inequities as a result of inconsistent increments over the past 20 years due to budget constraints. And these inequities have lasted for many years and through many administrations. This year, we've also sought to address pay inequities between current employees and new hires by requiring agencies to increase the salary of existing employees to the same level of new hires in the same unit. And at this point, we don't know how much these increases will cost, but we believe the change is in the right direction for our employees. It's the right thing to do. And Madam Chair, I'll just point out that this is just kind of an example. We love to get ideas. We'd love to have some type of suggestion on some things that can be done. And this was something that you recommended that we then assigned back to our teams, and they figured a way to do that. And so it's moving forward, and you'll see that reflected in there. So as an employer, we are embracing telework. And in fact, I'll point out to you that 2 years ago, our program for this was antiquated, to say the least. And the state has actually done a 180 when it comes to this, because that's also a reflection of the current job market. And we're accommodating flexible schedules. The state provides free transit to workers as they come to work, particularly when they do the light rail or something along those lines around the city. And we're enhancing and adapting efforts to support a very critical issue of employee mental health. Our latest challenge has just been to make sure all employees understand that this has taken place and to get that message out. And in fact, Cindy and I have had conversations with the governor's office and, how can we make sure that everyone's aware of some of these programs, particularly in light of the pandemic and the challenges that we're all seeing with that. Let me get back on script here. We've been implementing alternate schedules for employees and agencies and each offices, just ensuring that they are working collaboratively. Offering student loan repayments. That was a question that you had earlier, and Cindy addressed some of that. And increasing specialty pays, offering retention and hiring bonuses, and streamlining the hiring processes. In fact, those specific proposals were very creative, that were born from our long-lived crisis with correctional officer vacancies. And I have to say that Secretary Green has come forth over the past several years with differing ideas and suggestions. We've implemented a vast majority of those, and we're now seeing the net effects of that. Very positive, I might add. We have also been surveying applicants for the past 2 years. This was interesting to identify key employment considerations for them when deciding to apply for a position within the state. 42 applicants responded to this survey. 4,200, I'm sorry. I even saw it here, 4,200. 4,200 applicants responded to this survey. And by far, the greatest draw for applicants to state employment was doing meaningful work for the community or responses similarly altruistic in nature. So when I look through the responses on this, those were the highest numbers when it came to significantly and somewhat. Is that correct? Yes. And just as an aside, it's not in the script here. I think Cindy indicated to me that was required of us as a result from the Senate Finance Committee in looking at, what was the topic they were concerned about? Parental leave. And on those two higher issues, parental leave was toward the bottom of the list. And the way that it was done was her hiring team created 19 other issues for all of them to be compared side by side to. And it was quite eye-opening to the fact that we've even changed when someone goes onto the website, we're trying to highlight some of the things that we found were very attractive to people. Life balance while making a difference is one of the things that we've said, to make a difference in your community. The good work-life balance, flexible schedules. These were the things that were identified as very attractive. So we're now putting that up on the website for them to be aware of and take into consideration. The excellent health benefits package and the generous leave time. So if you have some more questions on that, I'll leave it up to Cindy to touch on, and that's off my script. I'm sorry about that. But as a result, we've redesigned the whole website to emphasize what people can get when they come to work for the state and to try to help their neighbors and their citizens. So while we agree the state is experiencing an unprecedented increase in vacancies, I hope that you leave this briefing with an understanding that DBM's personnel division has been taking an aggressive, dynamic, and a multifaceted approach in helping departments and agencies to fill their vacancies. And keep in mind, each agency, some of them might have the same title, but there might be different duties assigned within there. So no employer is perfect. We acknowledge that, but the state has been proactive, and we will continue to evolve as necessary to attract and retain employees. Madam Chair, members of the committee, that concludes my prepared remarks. And I appreciate the opportunity to be here in front of you. I think my whole team does. Thank you.
Thank you very much, Secretary Brinkley, for the presentation. We have a question from Delegate Resnick.
Thank you, Mr. Chairman. Secretary Brinkley, thank you for that presentation. I appreciate the efforts that the department and the state are making this year. You made a comment that you're doing it because it's the right thing to do. And I agree with you. It is the right thing to do. My problem with your comment is that it is the right thing to do in your final budget on the way out the door, where we have seen this problem as a slow-moving train wreck for years. And for the first time ever, or I'm sorry, not the first time ever, for the first time in a number of years, employees in most departments who are all part of the AFSCME bargaining units are finally seeing some sort of an increase, while many of their employees have been going out the door for years. And we're finally seeing some action this year. So I want to highlight for you and get your thoughts on what's being done for some of the staffing issues that my subcommittee has been seeing, specifically in the health and social services sector, that we have been talking about with the departments for years. The Office of the Chief Medical Examiner has been so understaffed that people have been walking out the door. We have literally been in a position that if the accrediting agency had not suspended all decertification of accreditation, we would be decertified from accreditation this year. Bodies have literally been piling up in the offices, in the halls. The Office of Healthcare Quality, OHCQ, has not had enough staffing of nurses to be able to recertify a single Montgomery County nursing home since the MOU with the county expired this June. I don't know why you guys let the MOU expire. The county has asked repeatedly to renew the MOU so they can do the recertifications themselves. It worked perfectly well for 10 years. You all let it expire, and not one single nurse has been able to get to a Montgomery County nursing home to recertify those nursing homes. There are literally dozens in the pipeline waiting. Madam Chair highlighted the problems at BHA. Social Security Administration and the Department of Human Services has been so understaffed by caseworkers that people literally can't get their benefits. And one of the things that's plaguing our state hospitals, people don't want to get jobs there because security is so bad. And this committee passed legislation on state hospital security, I believe 2 sessions ago. That bill is still not fully implemented to be able to get the personnel they need, so that regardless of the pay, they can come, people at those state hospitals can come to work and feel like their lives are not in danger every single day. So those are just 5 examples that we have been seeing on an annual basis, year after year. I have now been chairman of this subcommittee for 6 sessions. It's my 6th session. We have been having these problems every year. So this is not COVID. This is not the employment crisis that we've seen over the last 12 years. This is something the department has seen over and over again. So my question to you is, with these examples and others, how have we let it get so bad, and what are we doing outside of last minute salary increases to change the direction of the culture of hiring to state government?
Okay, so first, when it comes to OCME, the Office of the Chief Medical Examiner, we had challenges before, and then we addressed them by a specific, what we do, an ASR with them, or how did we granted some waiver to accommodate some of the increases that the then Chief Medical Examiner was pursuing. And I understood that we made some gains along those lines, but we also recognized, not unlike Maryland, I mean, Maryland's not unique there. OCMEs across the state or across the nation are having those type of challenges. When you have physicians who can come out and make $250,000 a year, and yet as your medical examiners, we're not, able to go that high. That's been a big challenge that we've had. We made some accommodations. I thought that was about 4 or 5 years ago, because we built a nice new building for them that then started falling down because of some construction issues with that. But we got some people in there, and I thought we had taken care of it, at least at that point in time. But I recognize that we're back up to another challenge here. Anything you want to add?
No, I think you.
So Secretary, I would make one additional point on the OCMA. We have been told that the number of sort of graduates coming out of medical schools in that field aren't sufficient to cover the national shortages that exist across all the states. So this is really truly a national issue at the OCME level.
Okay. And when it comes to BHA, I remember when the question was going along those lines, because the chairman's concern was they did revert a substantial amount of money. I don't know if this is the answer. We can certainly try to find out. I don't know that the reversion was necessarily tied to vacant positions. Maybe it was, depending on what the dollar amount was. But I know that we've also had a challenge just in the providers that provide those type of care facilities. We had all sorts of conversations about them not having patients then in the bed, and our contracts were set up for the money to go out the door based on what they were occupying. But we did have challenges in trying to make sure some of those were staffed. So that was that part of it. I'm trying to think of what one of the other questions was. And we can find out. I don't know that that's the answer to that. That's the thing
Mr.
that's
Chairman,
in my
I don't
mind.
really need,
Yes,
I don't really need a recitation of a section by section. We know we have problems in every one of those. What I'm trying to figure out is why we have let it get so bad over the years, and what do we need to do to not just increase salaries once in 8 years, but to change the culture that exists when it comes to staffing, so that we are not hearing the same thing year after year after year. That was my question.
Well, I'm glad that this year we finally were able to get to a resolution with AFSCME, because up until now, all the other unions came to an agreement. We had our back and forth, and they didn't. And this year, you know, we were just glad they were able to get on board. Now, it went until 12:31 at about 11 p.m. And we had 1 hour to go until we reached the drop dead site on that. So we're just glad they came on board.
Thank you very much, Delegate Resnick, for your question. And Secretary Brinkley, if DBM could work on long-term solutions with regards to this question, I think that'd be very important. Are there any other questions for members of the Appropriations Committee for Secretary Brinkley or DBM? Seeing none, do want to also emphasize to Delegate Smith's question that was asked earlier about the relationship between our higher education institutions and state government. In addition to the example that was offered by the University of Baltimore, there's also a program that's with the UMBC that this fiscal year, including the budget, is providing 16 technology interns who will be from UMBC, who will be provided to the Maryland Department of Information Technology, Department of Health, and Department of Labor. So that's just another example of the relationships that are being developed between state government, also with our higher education institutions. There's no other questions from the committee for the briefing on this. We will conclude this briefing and move on to the next briefing. Next briefing will be provided by the Joint Committee on Cybersecurity, Information Technology, and Biotechnology. And the Joint Committee chairpersons will be presenting. And first, we have Delegate Pat Young, who is chair of the committee, and also Senator Katie Fry Hester, chair of the committee on the Senate side. Joining them for questions, we have Ben Yellen, who's with the University of Maryland Center for Health and Homeland Security, Dr. Greg Von Lehman, University of Maryland Global Campus, Mr. Kevin Kennelly, Maryland Association of Counties, Mr. Waylon Crush, Chief Technologist, Cyber Motorola, Mr. Sam Bell, CISO Edwards Performance Solutions, and also Mr. Bill Webb, who is the health officer with Kent County Government. Before we get started, on behalf of Chairwoman McIntosh and the entire Appropriations Committee, we are very proud and honored that Delegate Pat Young served as the chairman of this committee, and we're so proud of the work that he's done. Chairman Young and Chairwoman Hester, please proceed when you're ready.
Thank you, Mr. Chairman. And thank you for introducing our panel. Fellow members of the Appropriations Committee, for the record, I'm Delegate Pat Young, House Chair of the Joint Committee on Cybersecurity, Information Technology, and Biotech. Well, it's always a pleasure to be in front of you. I wish that the information that we've gathered over the last year plus was more of a positive nature. If it's all right with the chair, before we begin, I'll pass on the mic to my co-chair, Senator Katie Fry Hester, to introduce herself. She was also going to introduce the panel, which the chair has just done. But Katie, go ahead.
Thank you very much, Delegate Young, and thank you to the Vice Chair, Madam Chair, and members of the committee for having us here today. For the record, Senator Katie Fry Hester, Senate Chair of the Joint Committee on Cyber, IT, and Biotechnology. As everyone is intimately aware, cybersecurity threats are increasing in frequency, sophistication, and severity. And last year, the Maryland Cybersecurity Council, working with the Joint Committee, completed a comprehensive review of state and local cybersecurity. And it's our pleasure to be here today to share the highlights of that as well as potential legislative outcomes. Thank you for introducing the panel. I just wanted to also thank our state CISO, Chip Stewart, as well as Secretary Russell Strickland for participating in the development of the report. Back to you, Delegate Pat Young.
So the Senator and I are going to go back and forth, and once we're concluded, we'll open up for questions, and our panel will help assist with any technical questions that we may not have the answer to right away. So I want to make something very clear from the outset. Our local and state governments are a target of cyber crime. This is not a theoretical experiment or an exercise. Maryland has been attacked more than once, and our state and local governments have lost millions of dollars in the aftermath of such attacks. One of the charges of the Joint Committee is the advancement of cybersecurity within the state. We received a brief recently, and we'll be receiving briefs related to the budget, but right now, proposed there is $100 million included to protect and mitigate against attacks, and there's $2 million for disaster recovery systems. And I will openly say that it's a good start, but without significant change to our overall approach to cybersecurity, we risk diluting the impact of this funding. Through evaluating state cybersecurity systems, the Joint Committee has endeavored to increase knowledge, awareness, and support of current and future cybersecurity information technology and biotech systems across the state of Maryland. In doing so, we also recommend actions to stay up to date with emerging technologies and meet current threats to our cyber infrastructure with consistent and rigorous assessment. Senator Hester.
Thank you. So the study that we mentioned covered three broad areas. The first was cybersecurity governance across the state of Maryland. The second was state agencies and their approach to cybersecurity. And the third was local units of government. And I'll just give you the really high level overview of what we found in each of those three areas. And you should have the full report for your reading pleasure. So the area of governance, we're really talking about a bird's eye view, a holistic approach of how cybersecurity is managed and the regulations and enforcement capacity. When we were conducting this research, it was led by Dr. Greg Van Lehman from UNGC, and the research that he looked at across the state revealed several themes. The first was centralizing executive branch IT and cybersecurity management. The second was requiring risk management in the procurement process. The third was empowering our state cybersecurity coordinating councils. And the fourth was enhancing specific plans to establish public accountability for cyber expenditure. Now, the problems that we found looking at our state governance was that DOIT's role, the Department of Information Technology, was hampered by several things, which won't surprise you given the presentation we just heard: limited staff and limited funding, limited visibility and ability to ensure compliance of other agency systems, and external exposures that appear in the procurement process. So that's like the whole first part of the report. The second task looked at state agencies. And here, for the first time ever, working with the Department of Information Technology, they surveyed the entire state executive branch, 114 IT systems completed the first survey ever. And I think it opened up a really productive conversation. However, we did find several things that were disturbing. First of all, 40% of our state agencies have legacy systems, which are clunky, risky, and expensive. 60% of our agencies had not conducted cybersecurity risk assessments, despite the explicit DOIT policy. And 37% do not employ multi-factor authentication. Now, this doesn't come as a surprise because as the Joint Audit Committee has also heard, over the past few years, specifically in a report that the auditors wrote from 2016 to 2019, there have been numerous instances of mishandling of personally identifiable information, and they cited nearly 40 million records as improperly stored and susceptible to fraud. The third area, and I'd like to give a shout out to Mako and Ben Yellen from the Maryland Center for Health and Homeland Security, looked at local school systems, local governments, and other local units. They conducted numerous focus groups and surveys, and once again, the results are not surprising. only 31% of the respondents, felt like they were sufficiently prepared in terms of cybersecurity resources. 60%, more than half, did not have a complete inventory of their IT systems and data. And only 20%, 1 in 5 units of local government, have a disaster recovery plan that includes cybersecurity. So these are just a sampling of statistics that you'll find in the report. And there's a more complete picture in the report. Back to you, Delegate Young.
Now, a lot of the things that the senator was mentioning during the last 9 months, the Joint Committee has been hearing from representatives from multiple states that have been actively pursuing the same sorts of things that we are, upgrading our cybersecurity systems, making sure that we're getting rid of legacy systems and that we're prepared for the next attack. All 50 states have begun implementing some form of cybersecurity initiatives or have already stood them up. We had the opportunity to be briefed by New Jersey. I believe, Senator, we had North Dakota came in and talked to us as well, giving us an idea of what they do, how well they do it, and how long they've been doing it, which influenced the legislation that we put forward and the recommendations that have come from the Maryland Cyber Council's report that the Senator was referencing, as well as the 3 briefs that we got during the legislative interim session. So one, I'll pass it to Senator Hester to talk about some of the legislation that we've suggested to address some of these findings and make sure that we're modernizing and moving in the right direction related to our future cybersecurity posture.
Thank you, Chair Young. So the first piece of legislation deals with governance. And in the first part of that report, there are 20 recommendations that relate to governance. And today I'd just like to highlight the most important ones for the Appropriations and Budget and Tax Committee. So one of these is that it's recommendation 3 for those who are following along in the report, is that all IT and cybersecurity functions and budgets of state agencies be consolidated. This means that the agency IT staff and their budgets will become part of DO-IT, and they will report to the state CIO. When we heard from the states that Delegate Pat Young mentioned, they had both saved money by going through this process. This legislation also includes references to recommendation 17, that the cybersecurity budget for the state enterprise should be consistently appropriated. It should not be based on the chargeback model that we currently use for state agencies to pay for DO-IT services. It also will include a mandate that the annual budget provide useful metrics on IT and cyber budgets, similar to the way the Congressional Office of Management budget does in their overview. It also recommends that enough money be appropriated to ensure that the annual vulnerability and risk assessments are complete for each unit of government. So that's the first kind of package in the first bill. The second bill deals with IT modernization. And we've all been suffering from many old state systems, and this would prioritize funding for upgrades guided by a newly created oversight process. We're basing this piece of legislation on something that Massachusetts did, where they bonded for $1.5 billion to update their systems over 10 years and to have an oversight body that looks at how that is done. It also takes advantages of the state leveraging the available federal funds, which are often a 90 Fed to 10% state match, and would require that we update all of these systems by 2025. The projects would be prioritized across the entire state, so it's not each agency fighting for their own program, and that would be priorities based on security, technical fit, business fit and customer experience, and the current maintenance and operational costs. The legislation also asks for a more efficient procurement process, granting DO-IT more authority in that process. The final piece of legislation deals with supporting our local units of government. This legislation would fully fund the existing cyber preparedness unit within MDEM. As you know, MDEM has a local emergency management response person in almost every county, and they would continue to support helping local county governments do vulnerability assessments, incident recovery plans, They would also work with DoIT to develop an online clearinghouse and training resources and model policies for our local governments. It establishes a local cybersecurity support fund that aligns with the federal infrastructure budget and the federal, state, local, tribal, and territorial grant program for cybersecurity preparedness. And it also establishes a new director of local cybersecurity within DoIT to coordinate between DoIT and MDEM. So those are the three components of the legislation we're proposing.
And all of these pieces of legislation came from, you mentioned before, the report, the hearings that we received from other states and from the experts in the field that are either have worked in Maryland or actively are working within our borders in different departments. But from an appropriation standpoint, I want to reiterate the fact that we have a unique opportunity here. We're often confronted with a significant need or problem that requires unsecured funds to be addressed. But this year, with the help of the federal government, we have seed funds necessary to begin this task. But I would warn the committee, again, from an appropriation standpoint, that at this moment, without a comprehensive change to how we approach cybersecurity, with a whole state approach, a centralized way of identifying how departments are, one, assessing themselves and assessing the entire state's security posture, department by department, it's impossible to put an accurate dollar amount on what it will cost to be in a position to definitively say Maryland's cybersecurity infrastructure is capable of meeting the needs of 21st century cyber threats. I will concede and mention that the budget contains several initiatives that are desperately needed, including $5 million in upgrading legacy systems. But as we've heard from other briefs, without being able to identify the number of legacy systems actively being used in the state, I cannot and will not say that $5 million is enough. There's $5 million to secure or for securing hardware replacements. Without a comprehensive idea or inventory of what hardware we do have, I can and will not say that $5 million is enough to meet that need. There's $10 million in consistent assessment and remediation of state systems. But as the senator mentioned, 60%, if I'm getting that number correct, Senator, have not conducted a security assessment of their own department. I cannot say and will not say the $10 million is enough to meet that particular need. With that in mind, I'll pass it back to the senator to close us out, and we'll take questions.
Thank you very much, Delegate Young. I think there might be additional money in a different fund that there's a much higher amount for these legacy systems. I still don't think it's possibly enough because we don't know how many we have. But I believe if we look at the major information technology projects, there's a significant amount of money there. We had a briefing earlier this morning with Aaron, and I think the $5 million figure was just specifically to replace one of those, not all of them.
Understood.
Sorry for that confusion. It was probably based on my poor note taking. But I do completely agree with Delegate Young that now is a time for decisive action. Like if you're a parent in Baltimore County, your kids were out of school. If you, because of a cybersecurity attack, the entire city of Baltimore, shut down because they were attacked. And this has real monetary costs. And now is the time that we've got a surplus in the state budget. We've got money in the federal infrastructure bill. And so it's a time for us to make big changes in how we govern, modernize, prioritize our infrastructure and our cybersecurity. So with that, we will take, I guess the chair will take questions, and just remember that Chair Pat Young and I were supported here by 6 people to help answer these questions, depending on what kind of technical aspect they include. Thank you.
Thank you very much, Chairwoman Hester and Chairman Young, for the presentation and also recommendations of legislations. The committee will now take questions from members of the committee. The chairman of the Public Safety and Administration Subcommittee is recognized. Delegate Bridges.
Thank you, Mr. Vice Chair. And thank you, Delegate and Senator, for your hard work with this and pulling all this information together. It's a pretty extensive report that I'm still kind of combing through. But I am interested in knowing a few things. It looks like each agency pretty much has their own oversight of IT. And in my mind, or it sounds like from the research that you've also done, that Do It or an entity like Do It for each state is the organization that really handles the oversight for the IT issues. Is that correct?
So there is a broad range of how states approach this issue. But however, in general, there's more and more consolidation. And so Vermont, the CISO from Vermont who we had talked to us, they had recently, redone everything so that each individual IT person in each department now reported to their new Office of Digital Services. They also went through a rebranding campaign. But now they have much more oversight, visibility, and they can leverage the purchasing power. And so in general, it's a trend, but I think that there's a phrase in the report that says there's as many different models as there are states. But it's broadly accepted that as you move towards centralization, you reduce the amount of risk in the federated system, which you currently have now.
And in terms of the report coming together, was MEMA as well as Do It also involved in helping to pull this information together for you?
Yeah, Secretary Strickland and his staff were present throughout the 9 months we worked on this.
For Do It, are they able to, if we have additional questions for them today, are they here as part of the panel to answer those questions?
So they are busy with the Maryland Department of Health investigation today. I believe that if you sent written questions, they would help. But we do have, I believe Sam Bell, with Edwards Performance Solutions is one of their contractors. So if you have a question, you could try to ask it.
Okay. Well, and they also come before the Public Safety and Administration Committee. So I'll also try to get some of those questions answered there. Thank you.
Thank you very much. The next question over here is from Delegate Kittleman.
Thank you, Mr. Chair. I have a question about the Maryland longitudinal data system. Was that part and parcel of the work that you all did?
I do not know if they received a survey from the state CISO, but we can find out for you.
Yeah, I say that because every year we add more very personal information about all of our students that lasts forever and ever, under the assumption that it's not penetrable by hackers, which I have difficulty believing, and it concerns me. So that one is one that really, really needs to be very, very safe. Thank you.
I'd agree with that, Delegate, and thanks for the concern. Absolutely. Any citizens' data that should be, one, secure and private should stay that way. And I think that some of the recommendations related to centralization would make sure that that's the case.
Thank you.
Delegate Novotny is recognized.
Thank you, Vice Chair Chang. I appreciate everyone bringing this topic up. It obviously is very important. First of all, I'd like to thank the committee for appointing my good friend, Delegate Nick Kipke. I think he'll be a great addition to your team and hopefully continue to robust the work that you all are doing there. A lot of the things that were presented today are about creating Do It into a larger organization, creating a new oversight body, centralization. But as we just spoke about maybe 2 minutes ago, Do It's in the middle, and the state CISO is in the middle of doing an investigation and helping out the Maryland Department of Health, which I think most cybersecurity experts will agree that it's not going very well. So my bottom line question is, how is this not just creating more bureaucracy and then throwing good money or good effort after bad, given the current situation we're in with the Do It and state CISO working on a very current ransomware attack that's affecting all of our citizens?
I'm happy to answer that, but also want to open it up to anybody on the panel who has a specific answer for that from the inside.
This is Sam Bell from Edwards Performance Solutions. I guess the thing that I would say there, certainly understand maybe some of the challenges from the past, but until you're able to centralize some of these functions, you basically have silos that then when you have something that needs to escalate, you don't have a kind of a unified framework to sort of escalate across, if you will. Because if somebody is attacking one particular agency within Maryland, it's entirely possible that that same attack may be hitting other agencies as well. Until you kind of roll all that back up together, DO-IT can have, really nobody can have a picture that is comprehensive enough to really see all the threats that are there and get a sense of the whole threat landscape. So realize there'll be some lift to get there, but that centralization really helps with the management and control of the state's infrastructure and cybersecurity posture.
I appreciate that detail, Sam, and I appreciate, the position that you're in there too. So with that being said, if it's done well, basically what you're saying, if it's done well, it should work out well for everyone in the state. But it also, if you are compromised in one computer and someone moves laterally, they also have the keys to the kingdom. If they pop one server, DHCP or DNS or something like that as you go through the network, isn't that the opposite of what you're saying too? But what you're saying is you're going to make sure this new grand network is very secure, right?
Well, I mean, exactly that. Well, if you're sharing authentication mechanisms, say across the state or something along those lines, you have to understand how each system is consuming them and how that's being used. And unless you have that visibility, invariably what happens is things get implemented maybe partially or get workarounds or go outside a system. And then what happens is you have another vector, another way somebody might come in that nobody even knows about in the state. And so unless you have that centralized, and unless the state can drive to a centralized architecture that addresses exactly what you're saying there, Delegate, in terms of making sure that things are containerized, that folks can't move laterally across our network, that's not the kind of thing that individual departments or agencies can design. That has to be designed at an enterprise level, at a state level, to make sure that it all adds up and you can't poke holes in it.
And generally, from my understanding too, from the brief we got last week, related specifically to the hack or the incident with Maryland Department of Health, the current system as it is with DO-IT, and while they're occupied now, they wouldn't have had the authority had they been able to catch whatever had happened, and we'll find out what happens after they give the brief after their investigation's done. They would have only had the authority to require the department to get off the state system, not make any mitigating or have a authority to tell them to change their practice or the way in which they do it. I think the plan here is to make sure that there is authority there, that once a threat is detected, it's more than just taking someone off the system. It's about changing practice.
Delegate Young, I appreciate that. And this is my last question, I promise, and I'll get off the stage here. One of the aspects was talking about cyber vulnerability assessments throughout the state. A great initiative, of course. The two of the things that were brought up were the National Guard IRT process and CISA, their capability of doing those things. There are so many systems, as you brought up. Has anyone coordinated with the Department of Homeland Security or the Department of Defense or National Guard and seen whether or not they have the capacity to do the amount of required cybersecurity assessments that we're looking for in the state, or is that just a up in the air recommendation?
I would say it's a up in the air recommendation. I think that generally at this moment, if we were to, I say we, or if there was a bill or even the governor asked DO-IT to do a comprehensive assessment of all of our state agencies related to their cybersecurity capabilities, they would have to find either through themselves or through bid through someone else to do it. We're trying to make sure that that's no longer the case by creating an agency that has the authority and the ability to make that internal identification of threats, of inaccurate and or inconsistent practices related to their cybersecurity posture, and making sure that that isn't the case in the future. I mean, I wouldn't speak for anybody else. I know that the CISA is coordinating with the federal CISA or our state representative related cybersecurity. There are a lot of resources out there, and even more growing just this year from federal dollars to help individual states stand up their systems and make them better. That's all laid into what I believe the openness of the legislation we're proposing, where it's not restricting our ability to use resources that are currently there, whether they're in tandem with the National Guard, in tandem with the CISA, or in tandem with anything that the federal government's also offering. So in my mind, or my vision, and I think our vision too, is that this is an open process where we're able to take advantage of any resource that could, one, bring costs down and meet our needs.
you so much. Thank you, Vice Chair.
Senator Hester. Sorry, Mr. Chairman.
I just wanted to add on that I was able to confirm with DeWitt that they have 75 assessments and penetration tests remaining out of the 114, and that according to the governor's office, there's $35 million in the governor's budget specifically for assessment and remediation. That's what's there now. As my co-chair said earlier, it is likely not enough. But if we quickly just go back to the second question that Delegate Novotny asked about the relationship, in terms of consolidation, the Department of Health was not actively working with DeWitt before the attack. And so, they've got $28 million in their operating budget for operating IT and $15 million for specifically related to IT related to Medicaid. So they've got a huge amount of money that's being spent on technology without the oversight of another body. And in my mind, the purpose of the Department of Health is to protect the public health. And so by relieving some of the pressures of IT and cybersecurity and giving that to experts, I think, as Sam Bell said, that will make our system safer.
Right, thank you very much, Madam Chairwoman. We have another question from Delegate Valentina Smith.
Thank you, Mr. Chair, and thank you, Delegate Young and Senator Hester. And, I know Senator Hester too at the last hearing with respect to the ransomware breach. You two have both been extraordinarily helpful in us understanding this. So, I just have a question in understanding kind of the role and where we are in government. So it says that cybersecurity governance is embodied in the framework of laws, policies, structures, and processes that determine how cybersecurity risk is managed within the enterprise. And I know that a large focus of this has been on the servers and the hardware and the legacy systems, but does this tie in with our overall kind of homeland security assessment of like our water systems and all of the cyber vulnerabilities to that, and to our electrical grid and the cyber vulnerabilities to our electrical grid? Or is this just really isolated to our servers and our kind of legacy communication systems?
That's a wonderful question, Delegate. So the pieces of legislation that I mentioned do not touch on our water or safety or our electrical grid or other pieces of critical infrastructure that are not government related. There is another study that was done this interim by the Cybersecurity Council. They worked with a fellow from NSA to conduct that study. I'm not as familiar with it, but we can get you a copy of that report. And I am working closely with the Attorney General's office to introduce legislation that will address those areas of critical infrastructure.
And if I could too, Delegate, thank you for the question, because it also plays to the complicated and expansive nature of 21st century threats and what we need to do to take it seriously and address them. So I'm mentioning that, agreeing with the senator, I think that when looking at the scope of what we have in front of us, some states might be in a position where this year they might be looking at those same things, where for us, I think that many of the folks involved believe that this is the first step in being in a place where we can meet those needs and address them effectively and accurately. If that, just wanted to add that, so appreciate the question.
Thank you, because I guess the concern is that through your good work, we will become very stellar and refined in this area of cybersecurity, which will then just direct people to other weaknesses in our cybersecurity or vulnerability with the water and electrical grid. So thank you for this body of work.
Are there any other questions from members of the Appropriations Committee for the chairwoman or chairman, or the members of the Joint Committee on Cybersecurity that are here today? Seeing none, that will end the briefing on the Joint Committee on Cybersecurity, Information Technology, and Biotechnology. Just a reminder to everyone that the next Appropriations Committee the full meeting will be on Monday at 3 p.m. We will have a briefing from the Department of Legislative Services on the fiscal briefing. We will also, all the subcommittee work members will also be starting their work on the budget next week too. On behalf of the House Appropriations Committee Chairwoman Maggie McIntosh and the entire Appropriations Committee, thank you very much for attending today's virtual meeting and have a great weekend.